So this is male and female sexuality. You see the top button, the on button, and then the bottom one, the woman, with all the bells and whistles and how you can get those buttons pushed. Well, as I was saying earlier, we guys, as we get older, maybe we get 3 or 4 buttons, but we're still a lot easier to click, 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 and be ready to go. And down there, as you can see, boy, if all the buttons and dials are not in the right direction, maybe something doesn't get anywhere. And this is the complexity of the genders. And there's nothing more that I can show you to tell you that this really only gets more challenging as we get older, because then the woman's having all the other issues with declining hormones and declining physical function. So recognize that menopause is not a time when everything stops. It doesn't have to be. Yes, there's an abrupt change in the hormones. I'm not going to get into hormone replacement therapy. That is a subject for another talk entirely that would take this entire time. But hormone replacement therapy is something that you should certainly discuss with your doctor. I think what is very clear, particularly as a urologist who sees a lot of women who have pelvic floor problems, estrogen, particularly vaginal estrogens, very important for pelvic health. We see a lack of vaginal estrogen is sort of the root of all evil for us, not just in terms of sexual function from vaginal dryness, which is the most common complaint, but in terms of frequent urinary tract infections, urinary incontinence, fallen bladder, all the other things that happen after menopause to the pelvis and the lack of pelvic structure are very much influenced by vaginal estrogens. And replacement of vaginal estrogens can be a key in order to get the health back of the woman's pelvis. So what are we talking about when we're talking about the pelvis? We're not just talking about the opening and the vagina. We're talking about the bladder, the control muscle, and all the muscles. Basically, I tell women, I show them hip to hip. Everything between your hips is influenced by estrogen. And the number one organ in a woman's body that needs estrogen is the vagina. Every woman knows that because after menopause, these problems happen. But guess what number 2 is? No, it's not the uterus, it's not the breast, it's not the hair, it's not the skin, it's not the brain, it's the bladder. Bladder is number 2. And that is why so many bladder problems happen after menopause, because of the lack of vaginal estrogens. So why am I saying vaginal estrogens and bladder estrogens? Well, guess what? If you put estrogens in the vagina, you will absorb them directly into the bladder. So you get a win-win. You get to treat your vaginal issues, and you get to treat your bladder issues. So there was a study done that was very surprising. It was a new drug that was looking to treat vaginal dryness safely. The concern about estrogen, of course, is about breast cancer. So why don't we give all women estrogen when we have these problems? So there's a lot of issues about the safety of estrogens and the risk of breast cancer. So these clinical trial people gave women a chemical that enhances estrogen and progesterone and testosterone only in the level of the vagina by giving them a precursor chemical that turned into estrogen in the vaginal wall, thinking it was very safe and wasn't going to lead to blood levels of estrogen that would be high and give them risk for breast cancer. Absolutely. That's what they found. Overwhelming success from this very safe chemical that's going to be out there probably in about a year for us to prescribe. Even in breast cancer survivors are going to be able to use this. So why are they so excited about it? Well, these ladies came back after 6 months of this trial of this medication, which was a vaginal suppository given daily for 6 months. And they said, Doc, I don't know what that was in that stuff, but my sexual desire is out the roof. So what they found out was that by making the vagina healthier in these women who were having difficulties with sexual function, it automatically improved their desire. Something that was a completely untoward and unsuspected side benefit of this. So recognize that when your vagina is dry and it hurts to have sex, that turns off the libido. And you've got to fix that before your libido is going to get turned back on. It's just not going to happen. And if you keep trying, it's only going to lead to a vicious cycle with more pain. And the first thing that turns off desire in a woman is pain. So a woman can have decreased arousal. She can have decreased desire. For most women after menopause, what they experience is known as responsive desire. So they don't have initiative desire like they may have had when they were in their 20s where they nudged their husband. But what they have is responsive desire, such that when their partner initiates, and maybe not right away, maybe they continue to read their magazine for a while, but eventually they decide, oh, all right. And then they start saying, maybe this isn't so bad. And then some of them, many women tell me in my clinic, sometimes we're halfway through it before I decide, hey, this is kind of fun. I think I'll go through with it. So that's called responsive desire. And recognize that's normal. That's absolutely normal. So both male partner and female, should not be upset that that's the way. This is how women work after menopause. So recognize that you may just have to keep going to get that pilot light lit and wait till the burners turn on and just be patient. Keep doing what you're doing as long as you're doing it right. Now, changes in orgasm can be the most frustrating for women because that seems to be something that becomes more elusive after menopause. Now, for women who have learned how to have a good orgasm beforehand, they seem to do okay. But a lot of women decline in their intensity and their ability to get an orgasm, and some of them lose it completely, and they don't like that. Well, you may need more stimulation. Your partner may need to learn how to do things a different way. And for many women, as you'll see in a moment when we get to some of the treatments, you may have to bring in a support team, and we'll talk about that in a moment. I've talked about this a lot, vaginal atrophy. Atrophy means loss of tissue integrity of the vagina. So we're talking about dryness, thinning of the tissues, loss of elasticity. The lubricants out there, the KY that you see advertised on TV now, that only treats the dryness. And I would encourage you in a moment when I go over this to use silicone-based lubricants. And the reason is that water-based lubricants or gel-based lubricants basically have been shown in studies to turn into something resembling glue in about 2 minutes of intercourse. So we recommend in our clinic to stay away from the gel and water-based lubricants. We talked about the need for estrogen in the vagina being the highest. We call this estrogen receptors, the little antenna on the cells in the vagina. Very much need, but again, the bladder second. There are different ways of giving vaginal replacement. You can give a cream that's given about 3 times a week. You can give a little tablet, similarly given 2 or 3 times a week, or you can give a little ring that's about the size of your key ring, of a very small key ring that's put in the vagina, very discreetly. You don't feel it. There's no discharge, and you change it out every 3 months. These are so small, most women can have intercourse with it in place without any discomfort. So Astroglide, Liquid Silk, KY, those are the ones that are water-based, gel-based. But you need silicone-based as KY Intrigue or Astroglide X. I don't know why they put the X on the end of it. I guess, X marks the spot, or they want to kind of associate it with sex. I don't know. But those are the better ones. They come in about a 4-ounce bottle for about $15, which will last you a long time. All it takes is a couple of drops, and you're good to go. We don't recommend using this in the shower. I don't want any broken hips or anything like that, all right? Don't want anybody slipping. Make sure you're in the bed. Make sure there's a pad down, because the silicone-based lubricants can get through the sheets and into the mattress. My associate at our female sexual medicine clinic, Dr. Peggy Francis, believes in olive oil and palm oil. Now, as a guy, I find it really hard to recommend those, but apparently they work, particularly in women who cannot take vaginal estrogens and for whom the other lubricants are not working for them. There are things called vaginal moisturizers, Replens, Refresh. These need to be used about 2 to 3 months before they benefit, and these aim to restore the normal chemical environment of the vagina. They are not something that makes up for nature's own lubricants, and the only way to get nature's own lubricants is by getting vaginal estrogens adequately replaced. And don't forget probiotics. Probiotics are very important. Many times for women, after menopause, changes in the chemical environment of the vagina lead to changes in the normal, good bacteria that live in the vagina. That predisposes you to infection, predisposes you to pain on intercourse, and in order to get those back where you want them, you got to take the pills. Okay? So I love Jamie Lee Curtis. She still looks great at age 60, but you'd have to eat like 16 jars of Activia to get enough of this stuff. So find a good brand that's an oral pill that you can take and get on probiotics. It takes about 6 weeks to 3 months to get your vaginal bacteria back where they should be, but there's a lot of data showing now that probiotics are good for our immune system, not just of our intestinal tract, but all over our body. For some reason, God put these bacteria in our intestine for a reason, and they have many, many different roles to play that we don't understand and are just now getting a grasp on. But I've had a lot of good feedback on my patients about probiotics.